Good afternoon, everyone. This is Gail Donovan with the Scottsdale Institute, and I'm delighted to welcome you to our webinar this afternoon. We're in for a real treat as we listen to Evan Heigert and Mitch Collier. Evan is the Creative Director of Patient Engagement with Wolters Kluwer, and Mitch Collier is the Technical Production Management Associate Director for Wolters Kluwer. The topic today says it all, putting the heart back into health education. It's another critical topic where we look at the intersection of both marrying consumer engagement with clinical content. What we're going to learn today from Evan and Mitch is various strategies to engage a diverse, heart-focused resources, simplifying complex medical jargon, building accessible user experiences through visual storytelling and inclusive design. And they will explore evidence-based patient education resources that can improve heart health through prevention, care, and management. Heart disease is the #1 cause of death worldwide. And I'm sure this number has changed. The last quoted number we have from 2019, almost 18 million patients per year die from cardiovascular disease. I will tell you, as an aging boomer, it's of particular interest. So I'm sure we will be pleased to learn more today from Evan and Mitch for both personal and professional reasons. I'm going to turn it over to Mitch. As a brief reminder, though, to everyone, we are recording this session. Both the slides and the recording will be available on the Scottsdale Institute website literally moments after we complete today. I'm going to ask you to please put your questions that you have during the presentation in the Q&A tab. We will have time to address questions at the end of the presentation. And obviously, so much of the value of our content is in engaged dialogue. So I encourage you to ask questions, please. Mitch and Evan really welcome that. I'm going to turn it over now to Mitch, who will get us underway. Mitch, it's all yours. Thank you.
Great. Thank you, Gail. My name is Mitch Collier. I'm part of the product management team here at Wolters Kluwer, and my focus has really been throughout my career around digital health and virtual care, and really looking at ways, working especially with member and patient education, and ways that we can enhance the clinician and patient relationships. So really excited to talk to you about our topic going through today around cardiovascular health. Evan?
Hello, everyone. Thanks for being with us today, and thanks for having us here. I'm Evan Heigert. As Creative Director for Wolters Kluwer Health, I have a really great honor of leading our creative editorial teams in developing our empathetic patient education. And I hope you will pardon the pun, but this is definitely something that's very close to near and dear to our heart, as we're always looking for ways to help patients take more control over their holistic health and be a part of their decision-making. Of which we know, as Gail pointed out, cardiovascular health is such an important part of that holistic health at this point. So thank you for having us.
Well, today we're going to go through a little background on the cardiovascular and heart health crisis. And Evan then is going to talk through about an empathetic way about building out heart health education and just patient and member education in general. And then I'm going to go through some examples and some practical ways of incorporating this education throughout the care path, and talking through a case study as well as some effective uses of education that got some great outcomes. So I think as we talk about addressing the cardiovascular crisis, as Gail said, this is a crisis that's worldwide and one that's growing. Sadly, heart attacks and strokes account for more 4 out of 5 of this cardiovascular deaths globally, and a third of these deaths occur in individuals under the age of 70. And it's not uncommon for the first diagnosis of diabetes to be made at the time of that heart attack. So this is something that is a crisis today, and something that sadly is growing in severity worldwide. And this comes at a time where providers and patients are also facing complex challenges with a focus on emergency care, clinician burnout, higher readmission costs and lower quality patient outcomes and satisfaction. This is a challenge for providers of care today. And again, with this growing crisis, this is something that continues to impact the delivery of care. When we look at the health plans and the payers, this is something that, cardiovascular health and heart health is something that is a focus of a number of quality measures. And when you look at different HEDIS measures and star ratings, you're looking at controlling high blood pressure, statin therapy for cardiovascular disease, medication adherence. These are all quality measures that the health plans are looking at. And as part of the 2027 star ratings, the Health Equity Index, this is something where measurement of these measures are really looking through the lens of underserved communities. So those members that are dual eligible for Medicare and Medicaid, those that have a low-income subsidy or disability. This is something that the payers are already starting to measure the effectiveness against these quality measures. And the result of this is continuing to drive more patients into the health systems. So as we look at those patients, particularly those with rising risk, this is something where, as we talk today, looking at opportunities along that care path and looking at ways that we can be proactive and focus on prevention and not really just thinking of education just at that point of discharge or just leaving a particular visit, but looking kind of throughout that whole continuum of care, whether somebody just received a diagnosis or is about to have a procedure or have a medication. Looking at if somebody has left a procedure or just in general kind of the overall longitudinal learning. There's a number of opportunities throughout, and particularly addressing those, trying to be proactive and really assist those patients and those members who are trending with rising risk and looking at ways that you can help them early before they have that more serious health event. And so this is really an area that we look at focusing and really helping that patient become part of that overall patient care approach and having that patient become an active participant, in their care. And when you look at, the complexity of the health system, many people, with fragmentation, have to deal with different deliveries of care, really helping to provide that patient, with the skills, helping information, helping to answer questions they may have, really empowering them to be part of that care team for their own care, and really working closely with their clinicians and in those different deliveries of care. So I think as we talk about today, as we look at ways that we can empower those patients and really help those patients to really get the resources they need to really help, again, become that active participant in their care, and looking at ways that we can help them early, and again, really helping to avoid any of those more serious health events later, and really provide them with the skills and the information that that they need as part of that. So Evan.
Thanks, Mitch. Yeah, as Mitch outlined, empowering providers to deliver that proactive care is really critical, but the positive impact can really only be realized if patients and those members actually play an active role in their heart health. So what we wanted to do, give you a little bit of a peek behind the curtain to show some of the design principles that at Wolters Kluwer we follow to enhance that empathy, push that understanding, and build trust with those patients. So most importantly, we also want to share some of the impact that we've seen by investing in these empathetic communications. So real quickly, let's start by addressing, Mitch did a great job of setting that up from a provider perspective, but let's address why patient engagement and specifically comprehension is so important. So I think we can all see as providers, as educators, that patients play such a key role in that healthcare decision-making. But when you stop and think about how much patient empowerment and health literacy actually impacts their behavior, it turns out to be quite a lot. So looking at a recent Harris poll, talking to patients, as many as 1 in 5 adults actually struggle to just understand basic healthcare concepts throughout their lives. Another point is that almost half of them said that they a lot of times don't feel listened to by the provider. Maybe they don't have enough time for them. Maybe there's a very specific concern that they didn't feel was addressed. And 60% of those patients said that their health would actually improve if they felt like they had more trust in the providers they were working with. So this miscommunication is obviously fairly negative from a patient perspective, but it also has a real financial burden on our system. By some estimates, as much as billion dollars, billion with a B, is lost as a result of this patient literacy challenges. So as population ages and health costs continue to rise, it is more important than ever that we're developing solutions to empower and enable patients to make these significant changes. So how can we as educators and providers actually aid comprehension? At WK, we like to think about the principles of multimedia learning that help enhance that understanding and that support through different learning styles. So this is what we like to call the anatomy of patient education. So it really begins with starting with evidence-based content that's written in very plain language. We aim for the 4th grade reading level so that we're not dumbing down the content, we're just making it accessible for all people to be able to access regardless of their literacy level. And then we deliver that content through a combination of text, human voice, and visual storytelling that we'll show you in a moment that makes even these complex concepts more clearly understood for the patients. And then very importantly, we also need to make sure that we're delivering that content in a way that is highly accessible for patients, that's adaptive to the devices and the situations they're in, and wherever possible, personalized for that patient as well. So before we show you some of those examples, just want to take a step back and say also healthcare is, I think we all understand, is not just about treating illnesses, it's also about addressing the root causes of some of these health disparities. So when we look at designing patient education content, we really recognize that there are many influences on a patient's overall wellness. This is what we call social drivers. A lot of times you'll see social determinants of health. We really see them as drivers because, in fact, 89% of the factors that affect a patient's health happen outside of the clinical setting. So the rest could be impacted by things like their social circumstances, the environment they're in, genetics and biology, things that a lot of times a patient does not have direct control over. But there's quite a bit of positive behavioral change that a patient can affect in their own healthcare and their own life. So for that exact reason, we always start by recommending patients receive content on healthy behaviors that affect their holistic well-being beyond just their acute or chronic conditions. So especially when addressing cardiovascular patients, we include topics like nutrition, exercise, the effects of substances, the importance of medication adherence, and even areas of behavioral health, such as managing stress and anxiety. So we find these are all really incredibly beneficial topics that add to that core cardiovascular content suite. And the goal is not to lecture patients on being healthier and being better in their behavioral approaches, but it's also to give them the tools to make that positive change to affect those drivers that actually will have a domino effect in a positive way across their entire lives. So from here, I want to go a little bit deeper into our content, and I'll start with our visual storytelling. So as you can see on the slide here, one of the key principles we tend to follow is to simplify and explain complex concepts in the most approachable way possible. So we found this is very successful through a very simple animated style that keeps the focus on one key concept at a time. So we want to be able to use simple design, simple colors, to avoid overwhelming a patient and really focusing on that key concept. I think we tend to recognize that when a patient is watching our content, they could be going through a very difficult time in their lives. They could be dealing with a lot. They could be a hospital setting, an ambulatory setting. And we want to just reduce that information load as much as possible so they can really focus their attention on understanding what is happening in their body and the decisions they need to make with their care team to improve it. So if we go to the next slide. Another approach that we like to take from a visual storytelling perspective is to use metaphors as a way to reduce the unease or the downright scariness that could accompany many conditions. So for example, in an example like this, we're actually showing how a garden hose could help explain how an aortic and there it goes. An aortic aneurysm could rupture in a patient's body. And as you could imagine, this would be a very frightening concept to try and explain using human anatomy, even if it was in a simplified, illustrated form. So our team is constantly looking for ways to evaluate the best ways of taking these complex ideas, making them more relatable, thinking about things such as color, the different viewpoints we can show, how to, in some ways, depersonalize more of those really intense, sometimes scary concepts, so the patient can reduce their fear and focus more on the learning. Another way we look to enhance that learning and reduce anxiety overall is just instilling a sense of humanity into our programs. So we can all recognize that the healthcare industry, by and large, can be a cold, sterile place for a patient going through a difficult situation. So through our patient education, we want to bring in more of those relatable scenes, slices of life into our content to just help patients better connect. So things as easy as showing the warm gaze of a mom with her little squishy little newborn first meeting each other, or the young boy here in his stocking feet helping prepare a healthy lunch, or the caring connection between a clinical staff and their patients. So in the end, we always want to just find slices of life that put context around the more clinical information. And we want to encourage people to see themselves in our content as they're engaging with it. So that's another important point of why representation builds trust and is such an important part of our process. So it's important to ensure that diversity and inclusion is embedded across patient education. So that could be everything from skin color, cultural background, showing gender diversity and sexual orientation. We also think about ways of showing diversity in terms of mobility level or socioeconomic realities, or even different body shapes. So when we're creating our content, we use the principle of universal design. What that means is it's almost impossible to customize every piece of content for every different viewer. So we use the breadth of our content to show a wide range of experiences. This is going to help patients see themselves in our programs. And it also encourages empathy for others who are going through similar situations, that they can see that others are being challenged in the same way that they are right now. So what I'd like to do, those were just like a very quick flyby of some of our design principles that go into the creation of our content. To kind of bring it full circle, I want to make sure that we could take a moment and share just a short segment of one of our programs so you can see how those multimedia concepts come to life in the actual education. So Mitch, if you wouldn't mind going to the next slide and playing the short video.
The first step in taking care of your heart is to learn more about how it works. Your heart is a muscle. It's about the size of your fist, and it's divided into 4 chambers. On top are the right atrium and left atrium, and the lower 2 are called the right and left ventricles. These 4 chambers work together to pump blood and oxygen to your body. Now, let's go over how blood moves through the heart. First, blood comes into the heart and fills the right atrium. Then it moves down into the right ventricle. At this point, the blood needs oxygen, so it moves from the right ventricle to the lungs, where it picks some up. This oxygen-rich blood then returns from the lungs and fills the left atrium. From here, the blood moves down into the left ventricle. Now, the left ventricle is the heart's main pumping chamber. It pumps this oxygen-rich blood out of the heart to the rest of the body to give it the oxygen it needs. Once the left ventricle fills with blood, it pumps most of it out of the heart. It does not pump out all of the blood, but a healthy heart should pump out more than half of it, so some of the blood stays down in the left ventricle. And the percent of blood it pumps out with each heartbeat is called the ejection fraction, or EF. It's called this because it's the amount, or fraction, of blood the heart ejects or pumps out with each beat. Now, your heart needs blood too, so it pumps blood right back to itself. The blood vessels that bring blood to your heart are your coronary arteries. Healthy arteries are like hollow pipes. When they're wide open, blood flows through them easily. All right, now you know how the heart pumps. And the more you know about your body and how you can take care of it, the better off you'll be.
Great, thank you. So I hope that that gives you just a sense of some of the conversational, simple ways that we deliver that content wherever possible for patients. I want to kind of close out with a couple examples of how best practices of building empathy, not only into the content, but also in the ways that you deliver that content. So we have seen as many as 70% of our viewers actually engage with our content on mobile devices. So it's really important to be able to design those experiences to be optimized, to be easy to read, engage, and interact with, even on smaller screens. As you can imagine, again, putting yourself in the shoes of the patient, they could be in a busy hospital setting, they could be on their way home, they could be sitting with a loved one trying to understand these key concepts. We want to make sure that they're able to engage with it as much as possible, and also build in web accessibility standards that help those patients with audio, visual, or cognitive impairments engage with that content as well. If you go to the next slide. Finally, we also aim to encourage active learning by embedding personalization into all of our programs. So we understand that the amount of content for a patient can be just totally overwhelming at times. Their time is very precious. So whenever possible, we enable our patients to kind of self-direct the content that is most relevant for them. So this is an example of a couple screenshots from our Movement for Physical Health program. So as you can see on the left, a patient can actually kind of self-select different chapters of content that deliver different exercises that are more applicable to them, especially based on mobility level. So adding personalization does a few things. One, it just in general shortens the amount of time needed to learn a key concept. We also find that interactivity actually encourages deeper learning because the patient is engaging with that information, not just passively viewing it like a TV show. And then ultimately, it makes our content more actionable. If I'm able as a patient to select personalized exercises in this case, I'm more likely to take that content away and practice it throughout my life as well. We go to the next slide. Just want to close out by showing some of the impact that we feel empathetic communication really has. I think objectively, we believe that empathetic patient communication is the right thing to do, but it really does have some impact and really important impact on some of those challenges that we talked about at the beginning of the presentation. So after talking with patients that have used this type of education, we see that 71% of patients said that they actually trust. Remember, that was a key challenge from the Harris poll. They actually trust their provider that was delivering that content to them more so than prior to receiving that. Comprehension is such an important part, as we've talked about many times. When we talk to patients, we see that almost 90% of them actually had a question answered in the patient education that they otherwise would have had to call their care team about. So not only is that empowering patients, it's also saving time for your care teams as well. As we introduce more interactivity, that kind of self-selection model, we see that engagement scores go way up. So it makes a lot of sense. A patient is able to engage with the content as relevant for them. Therefore, they're going to continue and complete that content more frequently. And then ultimately, everything we want to do is drive positive health outcomes, including just seeing how patients are better prepared and less anxious for procedures that they're going through. Example here of a colonoscopy program where there's 50% less readmission or return to those procedures because the patient felt more prepared to go through that procedure. I think we'll look at another use case and another case study of how this applies directly to cardiovascular health in just a moment. But just want to say, hopefully this gives you a little peek behind the curtain, some ideas around how to build that trust and understanding into the actual patient education itself. Would love to be able to answer some questions at the end of the program, but right now I'm going to hand it back to Mitch to talk a little bit more about how we can help integrate some of those experiences into your workflow.
Great, thank you, Evan. So as Evan said, I'm going to talk through some different examples about how we can integrate education really across the care delivery continuum, and go through a case study about how we've integrated education specific to heart health. So really looking at 4 different areas here. One, first talking through care management and care delivery, ways that we can integrate education into that clinical workflow. I'll talk about patient and member resources, looking at what kind of education that we can incorporate within health system and health plan resource centers. And then back to some of the proactive outreach and population health ways that that organizations have reached out to members and patients, and again, focusing on that kind of that proactive and prevention. And then lastly, around personalized digital health applications and the ways education can really augment some of those different personalized programs. So as you look at care management and care delivery, one of the exciting technologies is Smart on Fire, and this is ways that organizations can incorporate the ordering and assignment of education just directly within the clinical workflow. So as care managers or clinicians are working with patients or members, they have the ability to just right within that application, whether it's an EHR or a care management system, they have the ability to have recommended information based upon that patient or that member record, get a suggested list, be able to preview the right programs, and to be able to order that just right within that workflow. And it makes it easier so the clinician doesn't have to kind of exit or go to different applications. It's something that they could, obviously they're focusing with that patient or that member. And then really looking at ways that you can get that response and that interaction back to the clinician to really foster a dialogue. So not just sending information in one direction, but if that patient engaged with that, any questions that they have, ways you can get that back into the care system. And again, really having that where it's intuitive, it's personalized, it's based on that member record. The clinician doesn't have to go find all that information. It's something that is really really generated based upon the information that they've been working with in the system of record. As we look at optimizing different member resources, obviously there's a lot of information on the internet. There's a lot of information that that people see kind of in a variety of media, and it's very important, I think, for healthcare organizations really as you're incorporating. So the patient or the member doesn't have to go find that information. Being able to provide evidence-based resources, things that are just right within those organizations' resource centers. Education, as Evan talked about, that is really focused around plain language and optimized for engagement, and really tied in with other resources that might be in that health system or that health plan. If that member is or that patient is looking for scheduling a visit or has a particular topic that they're looking for, those different resources could be blended within. So it provides a comprehensive experience where the patient can find the resources they're looking for, schedule that time, but also can do some additional research and discovery just around education that's woven into that experience. As far as being proactive and outreach with a variety of media, whether it's digital, whether it's print, IVR, health systems and health plans do a number of ways that they reach out to engage with members and patients, and really focusing around maybe particular health services or health topics, and really looking, everybody is very busy. People have a lot of things that and just in daily life, and really trying to tie it to particular areas of interest or particular times of year, particular health observances, and being proactive with that education and those resources that's sent to those patients. Also things like IVRs, ways that you can not just have a reminder, but really maybe tie that to scheduling. So if somebody's overdue for an annual visit or a particular screening, ways that you can reach out, stress with education the importance of why that screening is so important, and then transfer that person over to schedule right there. People, again, have a lot going on in their life, and if it's convenient and easy for them to do that, just tying those things together, things can be really, really helpful. And then just lastly, around personalized digital applications, there's a number of applications that are available to patients and members, and blending that education in with that information is just very helpful. Again, those concepts that Evan talked about of really understanding some of the basics, things around hypertension, high blood pressure, really understanding what that means, different tips, and blending that in with maybe some of the information that you get from your tracker on your Garmin device or your Fitbit, other things. And this is something that again, there's a whole host of personalized solutions that are available, and really tethering that education in with those digital experiences are things that can really help to really have positive change for patients and members. So really, ultimately, patient engagement are things that that organizations can foster those longer term longitudinal relationships with patients and members, really not just at that point of care, but really pre and post, and again, and thinking of ways that you can be proactive in helping those patients, particularly those that are rising risk, and getting them the resources that they're looking for at the point that it's important to them, and extending the reach of the care teams beyond just a physical visit, ways that you can just continue to reinforce that with different interactions, particularly things like scheduling visits and routine preventive screenings, really helping people understand why those screenings are so important, and things like getting your blood pressure checked and medication adherence. Those are critical for patient care, and then really supporting more patients and caregivers, just really broadening your reach as an organization to support as many people and their caregivers as you can. So here's an example of a case study that we did with a healthcare organization with a hypertension program. So their goal was looking at their hypertension population and really boosting the amount of patients that had a blood pressure status on file, and then ultimately looking to get more people with uncontrolled to controlled blood pressure. And this is something where they had a series of email campaigns with the hypertension program, and checked in after 6 months and looked again to increase both recorded blood pressures and looking for changes in that status. So the hypertension program, this was an overview of hypertension, tips on how to control high blood pressure, that skill building and information about medication adherence and the importance of taking high blood pressure medication, and then also instructions for taking high blood pressure or blood pressure readings at home, and how to set different wellness goals for that. So again, helping to not just provide information about the overall condition, but different skill building and questions to ask their care team. So over 6 months, this organization saw a definite increase in those patients that viewed that program. Really saw a significant increase in those that increased the number of patients with a blood pressure reading on file, up to 66%. And then also importantly, those patients that engaged with the education were more likely and had a 16% increase in having additional blood pressure readings over time, and as well as saw a 15% increase of those patients that went from uncontrolled to controlled blood pressure. So this is something that, as part of this campaign, reinforcing the information that they got from their care team, and again, that proactive outreach and connecting with patients after that visit really helped to have some significant outcomes for that organization. So here at Wolters Kluwer, again, that the cardiovascular topics have been a significant use. With our overall 12,000 topics, 5 of those top 30 were heart related, and this has been a major area of focus for us. And looking at continuing to make sure that those are current, and over 400 different contributors with that. If you're interested in any additional information and a heart health point of care report, this is something from the Wolters Kluwer team. This is the QR code for you to be able to download that report. Great, and happy to answer any questions from the participants.
Mitch, thanks so much, and Evan. Really exciting content. I don't think there's any doubt that you are projecting that those approaches that the design principles as you define them, of simplicity, really speaking to the diversity, the use of metaphors is really pretty powerful. And congratulations on that incredible content. I'm going to remind everyone that we have lots of great opportunity to really engage in a discussion and Q&A. And I'll kick us off perhaps while we let people put their questions into the Q&A tab located at the bottom of their Zoom screen. But I'm curious, how do you ensure that the content that patients are receiving really aligns with clinical decision making? And maybe as an extension of that, or perhaps you think of it very differently, can you speak a little bit about integration into the wearables a little bit more, as well as EHRs? And, how does that content remain current and relevant?
Yeah, maybe Mitch, I can take that one to start. So I think that is something, as we talk through the content, there's one North Star that we always look towards in terms of building that content, Gail, which is always building from an evidence-based foundation, right? So at Wolters Kluwer, we're very lucky that we have both a clinical decision-making group from an editorial perspective and patient education and engagement. And we work very closely together in that way. So I think one of the last slides showed there was over 400 contributors to this topic alone. We have such a wealth of connection to those clinicians, those research experts that are in the field right now that are gathering that evidence on a monthly, weekly basis, and being able to integrate that into our content. So we consider that, well, we call it harmonization, where we're making sure that everybody's playing off the same playbook, basically, so that the content that's up to date and relevant for the clinical decision making is also baked into that patient education. I think that's the science behind it. The art behind it is how do you translate sometimes very complex or technical learnings into something that's engaging and understandable for patients. So that's where those visual metaphors come into play. Using more plain language, finding ways of taking those key concepts and breaking them down even further. And Gail, as you mentioned, just using the digital tools at our disposal to help toggle between those views is so important. So a lot of our content is embedded into the EHRs where the clinical teams are already working. And that's why I would just suggest for those that are using clinical decision-making tools and patient education tools is on a regular basis, just review that content and see how it's matching up with what your care teams are receiving, as well as what your patients are receiving, just so those conversations stay on that same baseline as well. So hopefully that helps shed a little bit of the light of that harmonization effort.
Thank you. I mean, that seems really powerful. And I know what, Mitch, you're going to add on to that answer in a moment, but just as a follow-up, Evan, what you're really describing is this incredibly large, diverse community that Wolters Kluwer works with to ensure that your content is up to date, which is, I'm sure, an incredible challenge given the rapid evolution and change of clinical practice, right? Everything from technology improvements to all the digitization that is occurring, let alone artificial intelligence and how that will contribute as well. But it's powerful to know that you're collecting all of that input to keep refreshed and updated your content on a real-time basis. So that's quite a body of work, quite extensive. But Mitch, I know you were going to add to this answer. I think about integration. Is that?
Yeah, absolutely. So a number of the EHR platforms and the care management platforms support standards like Smart on Fire. And so that allows you to bring an application in with a particular clinical workflow. So again, the clinician may be talking with a patient and they're in their EHR. They would be able to click on a tab and be able to get that education to send to that patient just right there within the EHR. They don't have to log into another system. They don't have to leave their screen. It's all just right there, part of their workflow. And then I think with a lot of the content is also tagged and indexed with particular clinical codes like ICD-10 or SNOMED. So the information that's entered in the EHR may be a particular diagnosis or procedure code or a medication code. All of the content and the programs are indexed to that as well. So when the clinician gets a recommended list, it's based on that tagging. So it's something that can really align with that care plan that they've just entered, or information that they've just entered within the EHR, and be able to get that recommended list that also have all of the educational resources. Again, the clinician doesn't have to go find all the information. It's things that are surfaced to them based upon the data that they just put in. As far as you asked kind of about, with device integration and others, there's a number of devices, starting with things like step trackers to, blood pressure machines, weight, scales, things that integrate in with different digital health applications. And again, we found that having education that goes along with that is really important, because people get hit with a lot of data, and just even, looking at blood pressure, what does systolic mean? What does diastolic mean? What is heart rate? When should you talk to a physician? If you have a number that might be, you have a question about. Again, just instead of just getting the raw information, looking at ways that, you can get questions to ask your care team, or information just about, the test itself.
That's really helpful. Thank you for that. Still an incredibly complex challenge. And we have a question from one of our participants, David Muntz, this afternoon, that I'll pose to you both. It is common to reveal new insights over time, clinical insights over time, which might suggest a course of treatment needs to change for patients, right? Pretty typical.
Absolutely.
How do you update the content and then get the viewers of the older content to read, and view, and act on the updated content? So that level of coordination as well.
Yeah, I'll say that's a really important part of our harmonization efforts. So our process is that we have monthly review cycles and annual medical review cycles, where we look across the course of literature that's changing in the field, highlight those changes, and then plan how to adapt that into our patient content as well as the clinical decision making. I think that timing is so important, right? So when the care team is seeing some of these updated literature or procedures, we're also delivering that to the patient at the same time. Sounds simple. It's not. It's a lot of review cycles. It's a lot of coordination between our editorial teams. I'll say this is the maintenance and the continual update and the nature of the industry is another reason why we use that really illustrated technique to delivering the content. Because as you can imagine, content changes so quickly. If we were using live action footage to show some of these procedures or to show some of these concepts, we'd be out there reshooting this content all the time. We've built that kind of flexibility into the way that we present our content through the tools that we use. So we can quickly bring in some new literature. We can bring in like a new animation sequence. We can adapt things. A really great example, I think, of that obvious one is during COVID and how quickly things change on a weekly basis, right? At one point, people weren't required to wear masks. Then the next week they were. So how do we go in there and update our content to be as current as possible? So that's really the key, is to keep those connections, that dialogue between the clinical decision-making arm and the patient education arm as close as possible. And the beauty of, I should have mentioned, all of our content, or the vast majority, is delivered through digital means, web-based tools, via mobile, via desktop-based web browsers. We can update that content on the fly, and it's always going to be the most up-to-date content. So there is no version control issues when a patient logs in and receives the content that they've been prescribed from their care team, or they self-select content relevant for them. It's always going to be the most up-to-date content that we can deliver. So that really helps clarify and make sure that we're on the leading edge of the information that's available.
That's really helpful. And so, Evan, you're pushing that content out through your digital means to your clients where they already have your products embedded in their various care management tools and processes. Is that correct?
Yeah, that's right. And, you know, from our when we're partnering with our customers, it's about communication, as you said, keeping them updated on the things that are changing on a monthly basis so they can go back and review that content. I'll also say we see those updates as a real great opportunity to continue to refresh all types, all factors of the content, I should say. So not just the medical accuracy, but also doing things like improving diversity and inclusion in our content, making sure we're building in more of that interactivity whenever possible. Maybe there's a new decision tree that we can deliver to patients to kind of give them the keys to find information relevant for them. Build in more of those mobility optimization techniques and things like that. So I think we see that content refresh cycle as a really great opportunity to always stay on the cutting edge of accuracy, but also just the user experience and keeping that up to date as well.
Sounds like you have a great feedback loop from your user community, which I imagine is a crucial component of you not only maintaining currency but accuracy in your engagement. Maybe go a little bit deeper if you could, and talk about language barriers, audio and visual barriers that may exist in patient populations. How are you accommodating for those?
Yeah, we just barely scratched the surface, I think, in the presentation, but I tend to think that this falls under the bucket of diversity and inclusion as well, is how do you meet patients where they're at? So a couple examples, obviously we're sharing a lot of content in English today. We know that with such a diverse patient population in this country and globally, many patients don't have English as their first language. And so how do we address those needs and make sure that they're accessing that content? So one of the things we do is we have a translation team within our editorial group that translates all our content into voiceover and text in Spanish first and foremost. So we're mirroring our English content with Spanish content. But then we also can go into an additional 19 languages where we either deliver transcripts, closed captioning in that language, or in cases where there's a very specific population that needs to be served, we translate that voiceover as well. So that's one key way. And as you mentioned, feedback from our patients that are using the content, as well as our care teams that are our partners and clients, is really critical there. The other piece of that, as you mentioned, is a lot of what we're sharing here is very visual in nature. For patients that maybe have visual impairments or on the flip side, audio impairments, we always want to deliver different loads of content so they're able to engage with that information as well. So we do that through closed captioning techniques where a screen reader could actually read back what's happening on the screen. We use design techniques that actually embed what we consider to be codes within the animation that help a screen reader actually explain what's going on screen. But then also making sure that there's like proper contrast of the colors that we're using, the size of the text, that there's transcripts available for a patient to review at their own pace afterwards. So in general, this is considered web accessibility standards. We follow the WCAG 2.1 standards, which are kind of a universal guideline for how best to address patients or just users on the internet with these various impairments. And so that's also a feedback loop. As technology changes, as new tools come out, new content approaches come out, we always need to be on the forefront of that. So again, marrying those updates from a user experience and the ways that we build the content with the ways that we design the content is really critical.
Mitch, did you want to add anything to that?
No, I just think it's important on the integration as well to if organizations are capturing preferred language or again, this is information as you're assigning the content, passing that information over. So again, it's not up to the patient to have to pick the language. It's already kind of pre-selected based on what they've provided earlier, and really providing kind of a sort of a consistent experience within the organization.
Thank you, Mitch. We have another question that's come into the Q&A, but really as a foundational question, perhaps I can ask you to speak a little bit about your business model. Are you actually contracting with provider groups of all different kinds, both health systems, individual physician groups? Are you contracting with insurers? I mean, you're providing these digital tools. And then the secondary question, which comes from Netu Verma from Advocate Health, is who's actually delivering the content of the education? Is that really retained by the providers because of with the tools that you've provided to them? So maybe you can speak a little bit about both the business model as well as the actual education itself.
Sure, I can speak to the, as far as the organizations that license our content. I mean, health systems, health plans, we license the both the multimedia content that Evan showed, as well as static content that organizations can incorporate with that. So that's a kind of a license model. And then again, the organizations then can incorporate that within their delivery. So like I said, some organizations use apps like Smart on Fire to be able to have the clinicians send that out. Organizations like maybe like care management groups within a health plan, those would be another organization that might send that out. And then others use the content within their libraries, out on their resource centers, things that they can so they can have sort of prescribed content which they kind of push out to members versus patient and member content that people can go find.
Yeah, so it's a real set of options that your client relationships have for licensing and accessing content, and then it's really the provider's choice on how they use, distribute, both at a personal patient level as well as kind of the gross consumer educational level. I like what I think, Evan, you mentioned this in your opening remarks, really I'm sorry, Mitch, it was probably you. The availability of content out there in the big wide world and the web, with everybody doing Google searches, it's incredibly complicated for anyone to really understand what to really view. And so building on those relationships, we know, does improve the level of trust and engagement. But were there any other comments, Evan, you wanted to jump in with here?
Yeah, I mean, that comment sounds like it could have come for either one of us or any of us on the call, I'm sure. But I think that's the point, is you need to be flexible. You need to realize that content can, there's multiple opportunities. I think when Mitch showed kind of like the different opportunities along the life cycle to connect and deliver that education, there's so many. And so we try to find ways, whether it's like Mitch was saying, integration in the EHR. So a provider care team can have a patient there, have a condition, and be able to send them information. Great. There's also automation built in. So we can set up either longitudinal care that is triggered based on a diagnosis, and then patients are getting content over time, or triggered to that population. That kind of simplifies all the steps involved from a provider perspective. Or again, being a trusted resource for patients, where maybe they've gotten some initial content from their provider, but they want to learn more about how to eat healthier, how to find more exercise techniques, and we deliver that as a self-service model as well. So it really is about like having as many opportunities to connect with that patient where and when they're looking for that information as you can, to make sure that you're connecting the dots across that education process.
I love that. That's really terrific. And you shared some incredibly powerful outcomes based on hundreds of thousands of surveys and feedback that you've received from clients and patients themselves. I mean, just to reiterate, 71% improvement in trust factors that patients are identifying after being educated. 89% improvement in comprehension of what they're being taught, and not only are you building engagement, but that's going to lead directly to improved clinical outcomes. The 50% improvement in clinical outcomes was the other data point that you shared. And I think that's huge, especially as we're all putting aside payment mechanisms to providers for a moment. Everybody altruistically is looking to improve the health and wellness of their consumer populations, right? And their communities of people that they're serving. And so this intersection of education, engagement, trust, and outcomes is intrinsically linked. So your work is so incredibly powerful. Any other comments that you'd like to share with the audience about this? If you don't measure it, right, it doesn't happen. So your focus on data points is really quite helpful.
Sure. Yeah, I think the data points are very helpful to kind of show the value of investing in patient education that builds that trust and empathy and so forth. But we also really, the qualitative feedback we get from our patients is also just as powerful. So how we gather that is in kind of two ways. First, before we create new content, if we see a need in the market, we'll sit down with a patient advocacy group, a patient advisory group. So we pulled patients from different demographics and backgrounds, especially where it's new content that hasn't been addressed to patients very broadly in the market yet, and try to understand better like where their mind is at, what questions they had when they were going through that process, what challenges or fears that they had, and then we bake that directly into the content we're creating. And then on the flip side, to kind of close that loop, as you were mentioning, for every program that goes out, we ask the patients to actually complete a short survey to give us some feedback on how helpful was that, what did they take away from that piece of content, and a couple of other small metrics. We don't want to spend too much more time with them, but that feedback loop helps us, along with the medical literature changes, to kind of evolve that content and improve it over time. So just like we said earlier, the patient needs to be a part of the healthcare process, and also in helping guide what education is going to be helpful for them.
That's terrific. Just a question that just came to me. Can consumers access your content directly, or does it have to go through a provider relationship?
Yeah, so in most cases, or Mitch, I don't know if you want to directly address that, but in most cases, it would be through a provider relationship,
Right.
Okay.
Either directly addressed to them or through that self-service model where a provider could have access to our content searchable for their patients via their platform.
Well, I'm telling you, I'm back to that personal comment. I'm getting jealous that my provider group doesn't have access to your content. So
we'll have to
follow up on that. But
Sure.
We are pretty much just out of time. I want to thank you, Evan and Mitch, so much for a really informative discussion and presentation today. I've learned a lot. I'm sure our entire audience has. And as you know, we're going to be posting this. I hope your contact information is one of the last slides before this Q&A slide. So people that want to follow up with you will know how to reach you. If it's not there, let's modify oh, there we go. Very good. And we want to make sure our audience knows how to get in touch with you for further information and to have more of a discussion personally. And Decretia also is going to put up a brief slide. We have a QR code. We love to receive feedback from our members that join our webinars so that we can constantly improve and take into consideration what your needs are and what your suggestions are for us going forward. Thanks so much again, Evan and Mitch, and to Wolters Kluwer. Really terrific content. We're grateful to have had you here today. And thanks everyone for joining us. Have a great rest of your day. Bye-bye now.
Thank you so much. Bye-bye.
Thank you very much.